Hello everyone, and welcome back to Wally's Nursing Videos. Today, we're breaking down the pathology of chronic bronchitis and emphysema and how they can lead to pneumothorax. Along the way, I'll be highlighting key nursing assessments and interventions to help you manage patients with these conditions effectively. Understanding these links will empower you in clinical practice to deliver better care and prevent complications. Let's dive in. Chronic bronchitis. Airway inflammation and obstruction pathology. Chronic bronchitis is characterized by inflammation of the bronchi, leading to increased mucus production, airway narrowing, and obstruction due to prolonged irritation, e.g., from smoking. Nursing assessment findings. Cough. Persistent, productive cough with thick mucus, often worse in the morning. Dyspnea. Shortness of breath, particularly on exertion. Auscultation. Raunchy, low-pitched rattling sounds, or crackles due to mucus. Cyanosis, bluish tint to lips or fingertips due to poor oxygenation, commonly seen in advanced stages. Nursing interventions. Airway clearance techniques. Encourage deep breathing and coughing exercises to help mobilize secretions. Hydration, increase fluid intake to thin mucus. Medications. Administer bronchodilators or corticosteroids as prescribed to reduce airway inflammation and improve airflow. Smoking cessation support. Provide education and resources for quitting smoking, as it is the primary risk factor. Emphysema. Alveolar wall destruction. Pathology. Emphysema involves the gradual destruction of alveolar walls, leading to large, ineffective air spaces and reduced gas exchange. This results in trapped air and hyperinflation of the lungs. Nursing assessment findings. Dyspnea at rest. Shortness of breath even during minimal activity or at rest. Auscultation. Diminished breath sounds and prolonged expiration. Barrel chest. Hyperinflation of the lungs causes an increased anteroposterior chest diameter. Use of accessory muscles. Observe for labored breathing, where the patient uses neck and shoulder muscles to breathe. Weight loss. Patients often appear thin due to the energy expended for breathing. Nursing interventions. Oxygen therapy. Administer low-flow oxygen as prescribed to prevent hypoxemia, being cautious of oxygen toxicity in patients with COPD. Positioning. Encourage the use of the tripod position, leaning forward with hands on knees, to improve lung expansion and ease breathing. Pulmonary rehabilitation. Promote activities that strengthen respiratory muscles and improve endurance. Nutritional support. Due to the energy expenditure from breathing, ensure adequate caloric intake and recommend small, frequent meals. Air trapping and hyperinflation. Bronchitis and emphysema. Combined pathology. In both bronchitis and emphysema, airflow obstruction leads to air trapping, where the patient inhales but struggles to exhale fully. This causes the lungs to hyperinflate, further reducing gas exchange efficiency. Nursing assessment findings. Pursed lip breathing. Patients may instinctively use pursed lip breathing to extend exhalation and prevent air trapping. Tachypnea. Increased respiratory rate as the patient tries to compensate for reduced oxygenation. Fatigue, due to the increased work of breathing. Nursing interventions. Breathing techniques. Teach pursed lip and diaphragmatic breathing to enhance lung emptying. Monitor ABGs, arterial blood gases. Watch for respiratory acidosis due to CO2 retention and administer interventions as needed. Energy conservation. Encourage pacing of activities to prevent fatigue and ensure rest periods. Formation of blebs and bullae. Risk for pneumothorax, pathology. In emphysema, the destruction of alveoli leads to the formation of blebs, small air pockets, and bullae, larger air pockets, in the lung tissue. These are fragile and prone to rupture, especially with continued lung hyperinflation. Nursing assessment findings. Increased dyspnea, worsening shortness of breath as blebs enlarge and interfere with normal lung function. Diminished breath sounds. Over areas of large bullae, breath sounds may be reduced or absent. Nursing interventions. Preventive care. Regular monitoring of lung function, encouraging smoking cessation, and minimizing activities that may strain the lungs, e.g., heavy lifting or strenuous exercise. Patient education. Instruct patients on early signs of pneumothorax, sudden chest pain, worsening dyspnea, and when to seek emergency care. Pneumothorax. rupture of bleb/bully, and lung collapse. Pathology. A pneumothorax occurs when a bleb or bulla ruptures, allowing air to escape into the pleural space. This disrupts the pressure balance between the lungs and pleural cavity, leading to partial or complete lung collapse. Nursing assessment findings. Sudden sharp chest pain, often on the affected side, with rapid onset. Absent or diminished breath sounds. On the side of the pneumothorax. Tachypnea and tachycardia. Increased respiratory and heart rates as the body compensates for reduced oxygenation. Tracheal deviation. In the case of a tension pneumothorax, the trachea may deviate away from the affected side due to pressure buildup. Hypoxia, low oxygen levels with accompanying cyanosis and confusion. Nursing interventions. Emergency management. Ensure the patient remains calm. Administer high-flow oxygen and prepare for chest tube insertion to re-expand the lung. Chest tube care. If a chest tube is inserted, monitor for patency, ensure proper drainage, and assess the patient's respiratory status frequently. Monitor for recurrence. After a pneumothorax, patients may be at risk for recurrence. Educate patients on early signs and symptoms to watch for. Nursing care summary. Bronchitis and emphysema. Frequent assessments of lung sounds, oxygenation, and respiratory effort. Administer medications like bronchodilators and steroids as ordered. Provide patient education on smoking cessation, breathing techniques, and the importance of pulmonary rehabilitation. Maintain ongoing monitoring of ABGs and oxygen saturation. Pneumothorax. Rapid assessment of symptoms, especially for sudden respiratory distress. Emergency interventions such as oxygen therapy and chest tube insertion. Continuous monitoring of lung re-expansion and patient status. Chronic bronchitis and emphysema can lead to dangerous complications like pneumothorax, but through proper nursing assessments and interventions, we can identify early warning signs and take swift action to improve outcomes. Thanks for watching Wally's nursing videos. Stay tuned for more nursing insights to help you in your practice. See you next time.